In late 2009, VA Secretary Eric Shinseki announced a 5-year plan to end homelessness among veterans. And the foundation of our plan is a no wrong door approach to serving homeless veterans. And what that means to us is that a homeless veteran ought to be able to go to any VA medical center, any outpatient clinic, any benefits office, or hopefully at any of our community partners and get immediate help, regardless of the door that they use. They should be able to get the help that they need. And our plan is based on 6 strategic pillars for ending homelessness. And they are outreach and education, homelessness prevention, treatment, housing and supportive services, income, employment and benefits, and community partnerships. And I really like this pictorial representation because all of those strategic pillars really are like interlocking puzzle pieces. You can't move forward easily with one without the others. And for us, the thing that ties it all together are really the community partnerships. I've been with the VA a long time, longer than I care to really acknowledge in this meeting. But in my career, I have never seen the resources and the funding and the new programs to help homeless veterans that we've been seeing for the past couple of years. I'm not going to take the time to go through what all these programs are. You can kind of get a sense. Some of them are very old, some of them are very new, some are kind of in between. But I hope what you'll appreciate is, number one, that we offer a very full continuum of services within our own system. And the second thing is that we really like our acronyms in the federal government. You know, they make us feel kind of secure when we get to work each day. And so, again, you can kind of get a sense. We have everything from, you know, the front door to the back door. And as I go through my presentation, I'm going to touch on some of these programs that heavily involve community partnerships. But as we've moved forward with our plan to end homelessness, we're now calling it a synchronized plan instead of a 5-year plan. And the reason for that is because of the emphasis on community partnerships. And the core philosophy to all of this is a housing first model, meaning that wherever a veteran's coming from, whether they're still getting high, whether they have untreated mental health problems, severe medical issues, that we should be able to house those veterans immediately without barriers and then work to address all of the other issues that may have contributed to that veteran's homelessness. Bottom line is, in the VA, we recognize we can't do it alone. I mean, yes, we have huge resources and we have a wonderful system that we work in, but we can only do what Congress authorizes us to do, and we're primarily a healthcare agency, and we also do benefits. So I think another important thing to understand is some of the things that are really crucial to ending homelessness, like providing housing, we don't actually operate housing ourselves. Any kind of housing that the VA provides, whether it's through contract or through grant or our key partnership with HUD, the HUD-VASH program, the housing is either funded or operated by a community partner. Partnerships work best when there's a shared commitment to a process and shared values. And when I say shared values, I'm talking about things like everyone agreeing that a homeless veteran is a person of dignity and worth and has a right to housing and deserves that by virtue of having served their country. It also helps to have a history of positive working relationships, even if they're kind of tangential. And I think most importantly, when the work is goal-directed and there are timeframes, deadlines, deliverables that everybody has to meet, that really moves your process forward. Some of the challenges that we've frequently encountered when working with other governmental agencies or community partners are things as basic as defining who's a veteran, because the VA, as a federal agency, has very specific definitions about who's a veteran and who's eligible for VA healthcare and VA benefits, and those definitions aren't always the same across other agencies or community partners. Similarly, in the VA world, historically, we have not always followed the HUD definition of homelessness, perhaps as closely as other agencies have, and I don't mean that in a bad way. I just mean when we're sitting with someone and they're sleeping on somebody's couch, and we've seen that they bounce from place to place, but they're not in a traditional homeless shelter system, we still consider that person homeless, even if other governmental aid entities or community partners might not. Another challenge that we've often encountered is that we may share similar goals with our partners, the goal being ending homelessness, but we may have different ways of getting to that goal, which is different objectives. So sometimes those things have to be worked through, and developing trust is really key. And I'll talk more about that in a few minutes. Usually the biggest challenges come in under the umbrella of bureaucratic obstacles and things that involve levels of decision making that can really slow down a process. So here are 11 quick lessons that we've learned so far about effective partnerships and building them. First is that if you're going to work with a governmental agency, you got to be patient and persistent and never give up because time in the government is kind of different than the rest of the world. And I know some of you in the room, I recognize you, and I know you will testify outside after this is over that, yes, the weeks roll into months and what's going on? So just never give up. You have to build your relationships on mutual trust and respect, and it's really important to understand your partner's world and to help them understand the world that you're in and operating from. Obviously, you can't go at this from an ego-based approach. It's got to be a team approach. You can't try to own it yourself. When you're trying to marry big systems together, or even small systems that are very different, you want to try and focus on win-win problem solving because that's the best way you're going to get things done. You're not always going to be able to come to consensus. So if you can minimize the barriers and maximize those win-win solutions, that's going to take you farther than coming up with the perfect solution that can never actually happen. You always want to make sure that your top management knows the issues and has input on your decision-making, and this might be pretty obvious for some of you in the room, but particularly when you've got layers and layers and layers of management and decision-making, it's really important to get everybody on board because ultimately you never want to make promises that you can't keep because that undermines the trust and the integrity of the process. It's also really important to keep your relationships going, keep your connections in the government. People move around, people change jobs, but even when new people come into key positions, if everybody can keep to what they said they were going to do, that moves the process forward. And I'll just touch very quickly on one example of this, is that several years ago, Mayor Bloomberg and Secretary Shinseki announced a plan to reinvent homeless services for veterans in New York City. It's called Operation Home. And at the time, the commissioner of the Department of Homeless Services was Robert Hess. And Robert Hess was a fabulous partner. He was a veteran himself, very committed to the process, and we did a lot of great work to streamline services for homeless veterans in the city, and I know Commissioner Diamond's going to talk more about that. But when Commissioner Hess left, when we heard he was leaving, we got a little nervous, like, oh, what's going to happen to this great partnership that we put in place and all this work that we've done? And who is this guy, Seth Diamond? But we were assured that Commissioner Diamond was not going to undo anything that was working well, and he has proven to be a very fabulous partner and has really helped us continue forward with our efforts to address veterans' homelessness. With these kinds of complex partnerships like Operation Home or even some of the other more complicated partnerships that we've worked on around HUD-VASH that involve multiple governmental partners, keeping in good communication is an ongoing process. You would think after a couple of years you got it down and you can kind of let it go, but things come up and you have to keep on top of that communication process even when you think it's going smoothly because it doesn't take much to undo it. And lastly, having a sense of humor is really important. And, being able to laugh at yourself, see the humor in situations really goes a long way. And I would say, if you're not able to laugh at yourself, you can always laugh at your partners behind the closed door. So, whatever it takes.